We went over the first few chapters, and now we are going into chapter 2, motivation. Why do people change? This is actually a very complex topic, but it's also incredibly rewarding. If you're able to understand motivation, then you're able to use it for you as opposed to against you. So the chapter starts off with first sentence. Do you think of your loved one as unmotivated? And this is something that's really important because this is often how we conceptualize their situation. Does their decision to continue using substances seem inexplicable, stubborn, or even crazy to you? It goes on to the next few sentences and says, by the time families come to us for help, they often feel as though they're living in a different universe from their loved one, or at the very least speaking a different language. And that's very common for people to be on very different wavelengths or have it be very difficult to communicate. However, at the end of this paragraph, their behaviors are not as mysterious as they seem, and your loved one is not as unreachable as you might think. And that's the point. The second paragraph talks about, and this is a little bit of a jab, but what they say is your loved one is motivated in at least one direction, and that's to use substances. Not that they're motivated, they're incredibly motivated to use substances. The lengths our loved ones go into in order to use substances is exceptional. It is above the bar. But the important thing is if you just take the substances out of the picture and apply that to recovery, that level of motivation would lead to success rapidly. So this chapter, the second sentence, this chapter will help you see the immense value in understanding your loved one's perspective. And that's the important point. If we can see and feel how they think, then that puts us in a position where now we can anticipate why they do what they do and how we can help change that. And so what it's saying in these first two paragraphs is it's normal for people to start in this game thinking that their loved ones are unmotivated and maybe even seem crazy, or to even be on a totally different universe or wavelength than us. But if we can develop the ability to understand their motivation and understand their perspective, then it's to our advantage because we can use that to help change their behavior. They talk about how motivation based on the action that they're motivated towards. In the case of substance use, the objective would be to feel happy or to relieve stress or to relieve depression, anxiety, or to fit in with peers. And that objective is what motivates them. So if you want to understand the motivation towards substances, then you understand what does the substances do for them. And then you understand what is motivating them. It's not just the substances. They're not evil people. We're beyond that. It's what the substances lead towards. The next paragraph, they talk about the first critical step in helping people change, because we're those people that are trying to help people change, is to understand their motivation for their behavior in their first place. We don't need to understand, this is what this paragraph goes into, we don't need to understand like years ago or decades ago what led to them using drugs and alcohol. What is more important is the here and now. What helps them make sense out of their behavior? What drives them to their behavior now? And once we understand that their behavior is goal-oriented behavior and not crazy or unpredictable or immoral, then we're able to look at their goals and manipulate that. Okay, now this is one of the most powerful sentences in the first few paragraphs. This is in the third paragraph. Understanding the reason behind a person's behavior contains the seeds of a solution to the problem. It could be that when the person finds another way to feel better and a better way to cope with not feeling better, she won't choose to drink. He or she won't choose to drink. Understanding what it is doing for them lets you start moving them in another direction. And that's important because let's say somebody is trying to escape anxiety and depression with their drugs and alcohol. If you can understand that as their motivation, as their objective, eventually the drugs and alcohol are no longer going to work to achieve that purpose. And if you can help them achieve that goal in a better way, once drugs and alcohol fail, then now you have the ability to help motivate them into that direction. This is really important information if you're able to grasp it. And I want to highlight that because if it's challenging to understand this, it's worth going through the difficulty to understand it because it's so important. Finally, they say in recent decades, researchers and clinicians have made remarkable progress in the science of motivation and change. They go on to talk about how traditionally treatment for substance use problems have conceptualized motivation as fixed. Like either you have it or you don't. And if you don't have it, then come back to treatment when you're ready. And family members in the past were coached to just disengage as if there was nothing they could do about it until their loved one got ready. And their loved one had to go out and experiment and hit rock bottom or, undergo an incredible amount of pain. And that was only until then were they able to do something about it. So they could passively wait for motivation to happen, or they could aggressively demand change. So either it's doing some sort of theatrical intervention or cutting off, or it's passively waiting until something happens. And what this chapter argues, and really what science argues, is that, and I'll just go to the beginning of this paragraph, thanks to good research, we know now that treatment providers, family members, and others are important to your loved one, and they can all have a positive impact on motivation. And we also know that the way we interact with people can either help motivate them or can push them back and do the exact opposite and have them hold on tighter to their substance use or pretend to comply without actually making a change. Now it goes on to an example. I'm going to skip that and go to the subsection of what is motivation. And it starts talking about how we discussed in one of the previous classes that addiction is located in the brain. And we talked about how it is a deficiency in dopamine and it changes the structure of the brain. And we also talked about dopamine's role in that. And what it says here is motivation can also be understood as to be in the brain. And so we talked about how when substances are used, they release dopamine in really high amounts in the brain. And dopamine is an incredibly important neurotransmitter in motivating people towards actions. And natural rewards also release dopamine. So when you eat or drink, then dopamine's released, and dopamine acts to motivate you towards that important life-saving activity in the future. But drugs release dopamine in levels that are much higher than any natural reward can provide. And so now drugs are something that hijacks that motivation center and tricks the brain of our loved ones into being incredibly motivated to use drugs. That means that their brain is leveraged into planning, organizing, and doing drugs. So they give an example of camping. Do you love it? Do you hate it? Whatever your feelings about camping are, like going out in a tent and being out in the wilderness away from electricity, whatever your feelings are about it, everyone has to agree. You have to be very motivated to take the steps to go camping. Who doesn't associate camping with any good rewards is not going to be motivated towards doing that. Somebody on the other end who, let's say, had a really good experience with their parents or their family member or their summer school or whatever, and then they go to a camp and they remember marshmallows by the fire, they remember boating and all these fun activities, that's the person that's going to have that dopamine release that reminds them to be motivated to take all those steps to go back for a camping trip. And previously we talked about how laboratory mice that are depleted of dopamine won't even be motivated to walk a few feet to get food that's placed in front of them. So dopamine is important for motivation. Dopamine and the motivation pathway in the brain are hijacked in addiction. So it's important to recognize that motivation is a factor when we're dealing with addiction. They say because the brain is a center for motivation, don't leave your loved one's brain alone. Continue to be engaged with your loved one's brain and trying to work and have access to your loved one's brain. Then it talks about internal motivation and external motivation. So internal motivation are those things like our values, our desires, and our self-image. So for example, I see myself as a good parent. So if my child is not doing well in school and getting in trouble, then I see that in conflict with my value of it's important to be a good parent. So then what do? That internally motivates me to then investigate what's going on, educate the kid more and try to coach them to do better. Then there's external motivation. External motivation comes outside of us. So that's like law, company policy, school rules, parental rules. Don't do this or you'll get in trouble. So maybe I don't have that internal motivator, but the school calls me in and says, if you don't take care of your child or fix whatever's going on with your child, we'll have to ask your child to leave. So there's internal motivators, external motivators. A couple paragraphs down, there's a really interesting sentence that says, research has shown time and again that it is essential that people develop their own reasons or buy in to change. So it's important to explore and discuss our loved ones' internal motivators. What are the things that were important to them? Is pleasing us important to them? Probably. Even if it doesn't seem like it, on a deep level that they may even not be aware of, it's probably an incredibly strong motivator. Is going to school something that motivates them? What are the things that internally motivate them? And then also keeping an eye on external motivators as well, and using both of them in order to help our loved ones get better. So external motivators are things like urine drug testing, close monitoring, careers that might be at jeopardy. There's a lot, and I would really encourage you to read this chapter because motivation is the important thing to understand if we're to really help our loved ones. And the more you can master this or understand this, the more you can feel in control of how to help others. I'm going to move on to another section where now they start talking about important bullet points about motivation, and then we'll go ahead and wrap up. So they have these important points about motivation that they write in italics. So I'm going to read each important point. We'll go over it to some degree, and then we'll wrap up. So the first bullet point they say is, when people see their behavior as inconsistent with their self-image or goals, their motivation to change can increase. When there's a gap between how we see ourselves now and who we want to be, that's a potential energy to motivate somebody to change. If you can get somebody to talk about their values, their dreams, their future, you can go incredibly far by just holding that contrast. If you go into like fill that gap, you can close that loved one down. So instead of saying, if you just would stop using drugs, you could go ahead and get into college, which is going to essentially close that person down. A better approach may simply be to explore their goals. Where do you want to be at in 5 years? Do you see yourself using drugs in 5 years? What do you see yourself doing? How is that different from now? Just holding that contrast. In motivational counseling, it's called developing discrepancy. That's the tool we use. We say just hold the contrast. Let them fill in the blank. Don't throw a dart and fill in the blank for them and then sort of pop that ability to do that. The second point of italics, the second line is, ambivalence is a normal part of motivation and the change process. Ambivalence means you have two minds about something. So you have to cut the grass. It's Saturday, it's your first day off. You kind of want to do it and you kind of don't want to do it. You don't want the grass to look unruly in front of the neighbors. You have people coming over, you have motivation to do it. You also don't want to spend the next hour or two cutting the grass, or the next hour cutting the grass. Maybe you just want to relax for a little bit. So you have reasons to do it, reasons to not do it. That's ambivalence, being two-minded about something. And that's a normal place to be. If I talk to somebody and there's no ambivalence there, something's not right. Maybe they're just not comfortable enough with me to be real with me. They talk about when clients tell us what they think we want to hear, their unswerving commitment to change, that they're just very committed to change, we're wary. We actually want to hear all about their ambivalence, the reasons, the pros and cons for doing what they're doing or changing. It goes on to say, many people and their loved ones believe that if a person returns to their old behavior pattern, he must not really want to change, or that he just can't change. A better way to conceptualize this, what they talk about is, it's more productively understood as the benefits of using outweighed the costs at that time. Because now you're able to think about it a little bit more objectively, like a scale. When people go back to using, the scale was tipped towards using. And what's within our control is to add weight to the other side of the scale to tip the balance towards change. And that is where our control lies. And to have the idea that we just have to passively wait for them to get it, either they're ready or they're not, would go against this idea of we have the ability to help our loved ones get motivated. And then it goes on to talk about a story of somebody who would go to meetings. And at the meetings, anytime somebody would relapse, they would be questioned about their level of commitment to change. So the person in the story learned a lesson that if he was to talk about him wanting to use, that his level of commitment would be questioned. And so that essentially just led to him feel like he was not able to disclose what was going on with him. The way they put it is the group became useless to him. It was as if he was presenting an incomplete and thus unhelpable version of himself. What's to help? Everything is fine. When people start progressing at this, even their loved ones, they start moving away from presenting a perfect version of themselves that's unhelpable because they have everything together, to start worrying more about presenting a more authentic version of themselves, a more complete picture of what's going on, because what's more important to them is getting the feedback and help in order to make things change. Okay, so the next italics is motivation is interactive, affected by environment, and you are the environment. So interactions with other people affect our motivation, and it has a huge effect on our motivation. If your loved ones use, it is not your job or your fault. This is the last paragraph in that section. We can't make other people change. What we can do is learn to provide an environment that lets them be less reactive to what we're doing and conducive to motivation. Then there's the next subsection, the things that can change motivation. And it goes through a list. And I would encourage you to read the list. Feeling acknowledged, getting information without pressure, having reasons that make sense, like logically thinking through it, getting positive feedback for positive change. Then it talks about things that crush motivation, like getting yelled at, not believing you can do it, having only one option, feeling misunderstood and judged. Acknowledging someone's point of view, truly listening to their perspective, and being as empathic as possible is what cultivates motivation. Telling them they're wrong because all we can see is how we're right tends to drive motivation down. Exploring options and letting any and all reasonable paths be a part of the discussion are ways to engage motivation. Trying to force someone tends to increase pushback. When you tell somebody they don't have a choice, they tend to reflexively want to prove to you that they do have a choice. The next subsection is talking about how confrontation is there's so much more. There's so much more to this chapter, but I'm going to just keep it moving. So confrontation is a big motivation killer. This is what they say in their first sentence. The evidence gathered in almost every study of therapeutic techniques is that resistance to change increases with confrontation. Confrontation in therapy leads to client resistance, which leads to more confrontation. So it's almost counterintuitive. It's like quicksand. It's counterintuitive how to get out of it. They go on to talk a little bit about the science. They say that although on TV you have these television shows where people use confrontation or interventions and it creates a lot of drama and there's a lot of secrets, betrayal, tears, confessions, redemption, and great reality TV, in reality there's a lot of evidence for collaborative, respectful approaches. So it talks about, the sentence says, respectful, collaborative approaches like craft have a 64% or greater success rate for getting reluctant people into treatment, while confrontational interventions succeed about 30% of the time. So they have their place too. And with that, I'm going to wrap it up. But what I'll tell you is that when we deal with treating addiction professionally, being able to understand motivation and then being able to yield it is an incredible tool. And it's not something, again, that's going to be a magic pill or a silver bullet, but this is a strong tool to keep in your toolbox and to continue to master in order to be able to use it effectively on our loved ones. So with that, we're going to go into the behavioral analysis, and there's some tables, and so we're going to treat it like an exercise, and we'll pull up the PowerPoint and go into it in a little bit more depth.